Good evening to everyone and welcome to today's wonderful session. I hope you're all doing great, scaling up every day with confidence, no confusion, no panic, no worries what are going to be the result. That is most important. Every day morning as you wake up, take a test on the Incus app. 100 questions, full-scale grand test. Once you have done the test, you try to identify 5 to 10 topics. Evening, you participate in discussion with Dr. Murali Bharadwaz. Do this seriously, consciously, every day. Good to see Bhargava, Sitaraju, Abhiranam, Harshavardhan, and many more who are all online. Thanks for joining the session. So every day evening, ideally at 6 o'clock, sometimes I get delayed. It may be at 8 o'clock, 9 o'clock or 11 o'clock. We keep you updated. Just be part of our WhatsApp study group. Yeah. So every day, 100 questions, full scale grand tests. Hand-picked questions, which are short questions, which are going to come in the tomorrow's NEET PG exam. Once you are doing practice with Dr. Murali Bharadwaz, studying every day with Dr. Murali Bharadwaz, nobody is going to stop you from becoming the topper in the tomorrow's entrance. So let's make the great beginning, doctor. Now, these are all the disorders of the thought process. Loosening of association, blocking of the thought, circumstantiality, they're all considered to be the disorders of the thought process is what you need to remember. So what is loosening of association? There will be ideas that shift from one subject to another that is completely unrelated. And the speaker is unaware that the subjects are unrelated. And where do you see loosening of association? Schizophrenia and mania. Thought blocking, a sudden interruption of the flow of the thought before it is finished, is called thought blocking. Circumstantiality, it is the disturbance in the associative thought and speech process where the patient gets certain unnecessary details, inappropriate thoughts before communicating the central idea. इसको हिंदी में बोलते हैं असंदर्भ प्रलाप. So where do you see circumstantiality? Schizophrenia, obsession, certain cases of dementia is what you need to remember. So you should know what are the disorders of the thought process, disorders of the thought content, etc., etc. Now, doctor, mutism. It is a characteristic of depression, conversion, hysteria, catatonic schizophrenia, in all that. So there is a refusal to speak and a kinetic mutism means even spontaneous movements are not done and vocal sounds also don't come. Labile, indifference means even though there is a severity, there is a disregard for the symptoms in spite of severity. That's called labile indifference. That's called beautiful indifference. So where do you see this? Hysterical anesthesia, conversion reaction, etc., etc. is what you need to remember. Good. Keep punching your answers, doctor. If you are proactively punching the answers, then it is more bidirectional interface. You know, today YouTube इतना important हो गया हमारे जिंदगी में. It's a beautiful invention to make a live broadcast reach to anybody on this planet on the planet Earth. It's a free class. Virtually, you don't need to pay anything to the commercial coaching programs, just if you are there on the certain good number of YouTube channels. Today, this teacher, that academy, this academy, everybody will be posting at least 4 or 5 videos. Usse jyada kya chahiye? Really, you don't need if you're a proactive student. So that is the reason. Recently, one IAS officer who got selected in IAS said, मैं कहीं भी कोचिंग को नहीं गया, खाली YouTube को देख रहा हूँ, live classes को देख रहे थे, right? So that is the reason, doctor. Let me tell you, any coaching program or anything, the purpose is not to create that informational toxicity, which is dangerous. The purpose is to stimulate you, to bring that focus in your life. That is the purpose of any coaching program, not to give you so many facts which are not tested in entrance or it is difficult for you to remember. So that is the reason I am telling you, what is the secret of success? Secret of success. Every time I tell the same to all the students. Read less. Read focused. Third, understand where are you falling short. Where are you falling short? And you try to fill those gaps quickly. Fill those gaps. Maximum एक topic में कितना रहता डॉक्टर? 20 points रहता. इस 20 points में there are 3 to 4 points which require reasoning. And 3 to 4 points will be बट्टी मारने वाला items रहते. 3 to 4 बट्टी मारने वाला items. बट्टी. 3 to 4 will be list of things. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So once you master this in each topic, कितना देर लगता? 10 minutes लगता max. There are totally 953 topics. Within 200 to 300 hours में आप पूरा चीजों को मुट्ठी में ले सकते. But you should know what are the topics within the topic, what are the points that you need to emphasize. And that is the whole purpose delivered by Dr. Murali Bharadwaz to you. There are 2000 HD videos, high density videos. Each 20-30 minute ka videos hai. It will cover all 19 subjects, short videos. And you will get that 20 points on each topic comprehensively. And daily grant test containing 100 MCQs on the Incus app will help you to identify where are you going wrong. And quickly go to these 2000 HD videos on the Incus app and try to do the revision. Bus, you will get the simple secret. इसके लिए उस कोचिंग को इस कोचिंग को भागने का जरूरत नहीं है. कोई भी कोचिंग को गए तो हर एक कोचिंग गुरु यही काम करने का कोशिश करता है. So now doctor, what are impaired in psychosis? Judgment, insight, personality, they are all impaired, not consciousness. A psychotic patient is fully conscious, he is not comatose. Delusion of infidelity on the sexual partner. डाउट मारना क्या होता है? ओथेलोस सिंड्रोम. पति पत्नी और ओ, पति पत्नी और ओ होता है ओथेलोस सिंड्रोम. Delusion of infidelity is what you need to remember. 1-year-old child radiograph is being shown to you. Like a Dronachari, I'm asking you, Bolo Arjun, kya dikh raha hai tujhe? So you should make a diagnosis. Definitely, out of 200 MCQs, doctor, in the tomorrow's NEET PG, 20 to 30 MCQs will be image-based. Very easy to answer because out of them, 5 to 6 will be radiographs, 2 to 3 questions will be ECGs. ECGs, don't forget, in the NEET PG. So if you go to the Incus app, download Incus app. If you download the Incus app में आपको दिखाएगा कार्डियोलॉजी में, जनरल मेडिसिन में there are totally 12 videos, each 20-minute वाला duration, covering everything about ECGs. The best place for you to master. Just go and download the Incus app and go to the 2000 HD videos ka program, right? So doctor, the diagnosis is scurvy. So basically, the epiphysis of the lower end of the both the femorals, small and irregular with a provisional calcification, and there is a metaphyseal band of radiolucency. So these are all the important things that characterize the scurvy. And the band of radiolucency, you know, here you are able to see the band of radiolucency. बराबर? इसको बोलते हैं scorbutic tremor fields zone. Scorbutic tremor fields zone. And there is a dense area of provisional calcification, which is called white line of Frankel, is what you should remember. And epiphysis will become ring shape, which is called Wimberger sign. And this area is called Pelkin's spar. And there are periosteal hemorrhages. These are the characteristic features which you need to remember when it comes to the scurvy. Upper GIT, barium, what do you see, doctor? The Sankhya 3 reverse हो गया. What is this called? Reverse 3 sign. Can you see? The number 3 is being reversed. So where do you see? Typically whenever, yes. So whenever there is any acute pancreatitis or a cholangio, whenever there is any carcinoma head of the pancreas, head यहाँ बैठता ना, so it will lead to the compression. So reverse 3 sign. Now barium enema, what do you see here? Lead pipe appearance. All those mucosal folds are gone. You are able to see the lead pipe appearance. Good to see Mehala Mohan, Harshavardhan, Abharanam, Bhargava Sitaraju, and many more who are all online. Please invite your friends also. So, doctor, ulcerative colitis, lead pipe appearance. Then, can you see a delta? Empty delta. Whenever any thrombosis of the superior sagittal sinus is there, then you get empty delta. And what do you see? This gas shadow is abruptly cutting off. This is called colon cutoff sign. It is typically a feature whenever there is any pancreatitis or ischemic colitis or a thrombosis of the mesenteric vasculature. Any of them can lead to colon cutoff sign, abrupt amputation of the colony gas is what you should remember. Pigmented dermatofibroma. Where do you see? Typically on the limbs, pigmented dermatofibroma. It is usually less than 6 millimeters and most common on the limbs. The most common type of melanoma is superficial spreading type. Superficial spreading melanoma. Seminofistula for dialysis. You take it from subclavian vein, radial artery or cephalic vein. So seminofistula is what you should remember. So cold storage time during transplantation kitna hota hai? The favorite question of the examiner, doctor, for the kidney, 72 hours. Once more, I am telling you now, बट्टी मारने वाला लिस्ट है, बट्टी मारने वाला लिस्ट है. Don't forget, because transplantation is the favorite topic of the examiner. Transplantation. Kidney 48 hours, liver 24 hours, pancreas 24 hours, small intestine 8 hours, heart 6 hours, lung 8 hours. आप कुछ भी करो इसको याद रखना मेरे भाई, ठीक है? तो is there any way to remember? Definitely. Kidneys are 2 kidneys, right? So that is the reason 2 into 24 is 48 hours. Liver is only 1 liver, 24 hours. Pancreas only 1 pancreas, 24 hours. Barabar? Then comes lung is 8 hours, small intestine is 8 hours. Even though you have 2 lungs, still lung is 8 hours, small intestine is 8 hours. Some way you try to mug it, doctor, because the examiner want that you mug this and come to exam. Which parotid malignancy is slow growing with the longest survival rate, doctor? Adenoid cystic carcinoma of the thyroid. It remains asymptomatic for years. It spreads perineurally, grows slowly. It is fatal, but 5 to 10 year survival rates are 70 and 40% respectively. Opsoclonus with myoclonus is seen with neuroblastoma. So about the neuroblastoma, 5 बट्टी मारने वाला आइटम्स मैं बोल रहा हूं डॉक्टर, लिस्ट बनाओ. एक फुटबॉल ले लो, मन में याद रखो, कल मुरली भरद्वाज याद आएगा एग्जाम हॉल में जब एग्जामिनर न्यूरोब्लास्टोमा, विल्म्स ट्यूमर, without that there is no question paper. बराबर? So the most common abdominal tumor in children. Answer बोलो राजू, neuroblastoma. Most common age, answer bola Raju, below 2 years. Most common site, adrenal medulla. Most common site of metastasis in infant from the neuroblastoma will go to liver. Older children में neuroblastoma कहाँ जाएगा? Answer बोला Raju, bone को. So these are the points which are frequently asked in the tomorrow's NEET PG exam, doctor. For the liver's functional result, what is the best test? Indocyanine green clearance. It has a peak spectral absorption at 800 nanometers. Glucagonoma. What do you get? What is this condition called? Necrolytic migratory erythema. So, necrolytic migratory erythema, DVT, hypoaminoacidemia, they are all the features of the glucagonoma. Renal glycosuria, anemia, hypocholesterolemia, any of them can occur with glucagonoma. Please remember. Extra gastric disorders in H. pylori. H. pylori lead to iron deficiency, autoimmune thyroiditis, and Raynaud's phenomena. They're all the features. Once more, I leave the literature for you. Neurologically, Parkinson's disease and migraine can occur with the H. pylori is what I want to underscore to all of you. Once more, doctor, let me tell you, all these videos, PowerPoints with explanation is all available in the Incus app. No worries. So, for you to do the revision, the safest for insertion of a chest drain is in the triangle of safety. What are the boundaries? Mid-axillary line, anteraxillary line, and upper border of the fifth rib. So the inferior nipple. So inferior nipple line, right? Or fourth or fifth intercostal space. This is anteraxillary line. It is the lateral border of the pectoralis. Major will form lateral border. So pectoralis major, latissimus dorsi, and external oblique, they are the boundaries. On the surface, how do you mark it? It is the mid-axillary line, anteraxillary fold, and upper border of the fifth rib. They are the boundaries of triangle of safety, is what I want to underscore to all of you. So the commonest site of intraperitoneal abscess, pelvic abscess, is the most common location, is what you should basically remember. Guardian of genome, master watchman, it is P53. Superior parathyroid, where does it lie, doctor? Where does the superior parathyroid lie? So you should remember that inferior thyroid artery. So 80% occur above the termination of the inferior thyroid artery close to cricothyroid articulation. So it is very close to the inferior pole of the thyroid, is what you need to remember. In portal hypertension, which part of the stomach you see the varices? They're all generalized everywhere. But if there is a splenic thrombosis, then along the greater curvature you find a lot of varices, is what you need to remember. Now, doctor, overwhelming post-splenectomy infection. It is seen in about 4% of patients without prophylaxis. Radical prostatectomy, what are the indications? T1 and T2 stage disease, negative bone scan, negative chest X-ray, serum PSA should be less than 20. That is where radical prostatectomy is being done. What is the specific cystoscopic appearance that you see in the case of the bilharziasis? Just like TB, but not TB. Pseudotubercles are the classical features. And there will be sandy patches, which are the result of the calcified dead ova, is what you should remember. Chronic peritonitis is pathognomonic virtually in HIV infection. Von Hippel-Lindau's disease, renal cell carcinoma is associated. So this is the typical retinal detachment in case of von Hippel-Lindau's disease. So what is the combination of things in von Hippel-Lindau, doctor? Hemangioblastomas, pheochromocytomas, renal cell carcinomas, pancreatic cysts, endolymphatic sac tumor, bilateral papillary cystadenomas of the epididymis, or broad ligament or the uterus. And where is VHL gene located? VHL 3, chromosome number 3 is what you should remember. Now, in torsion of the testis, typically rotation occurs mostly away from the midline. And that too, left testis rotates anti-clockwise, right testis rotates clockwise and away from midline. Blunt aortic injury cycle. There is a widening of the superior mediastinum to more than 8 centimeters, which is considered to be the most, more than 8 centimeters, widening of mediastinum, most sensitive test. Prophylactic subcutaneous mastectomy. If you do that for the high-risk women, it decreases the incidence by almost 90%. Breast cancer. Male breast cancer, how do you do? Modified radical mastectomy with axillary clearance is the standard treatment. Inoperatively, if you want to localize insulinoma, what is the best test? This is endoscopic ultrasound trying to identify small insulinoma. But the first line investigation is ultrasound. Endoscopic ultrasound is sensitive to head but not tail. But most widely used investigation to identify insulinoma will be CT scan, is what I want to underscore to all of you. But if you want to localize, then selective angiography is considered to be the important investigation, is what you should remember. Now, with regard to the hypospadias, the foreskin is there, but it is hooded. That's what you should remember. The foreskin. Acute appendicitis, typically perforation is more likely in the children compared to the adults, because the children have a very poorly developed omentum to contain the spread. That's the reason perforation is more common in children compared to that of the adults, is what you should remember. Gastroscus versus the exomphalos. You should know the difference between the two. So once more, doctor, this session looks like we are running very fast. But if you solve this as a question paper before attending the session, then that will be really great. Gastroscus, the bowel which is extruded is non-rotated, foreshortened, covered by fibrinous peel. Prognosis is good. Exomphalos, other abnormalities are associated in relatively poor prognosis. Thyroglossal fistula, the inadequate drainage of the thyroglossal system that lead to the development of the fistula. Usually, liver transplant has 5 anastomosis: suprahepatic IVC, infrahepatic IVC, portal vein, hepatic artery, bile duct. So first, last, bile duct. So there are totally 5 anastomosis in liver transplant, is what I want to underscore to all of you. Tumors of the parotid gland that are often found in the superficial lobe than the deep. They are often benign and they are common than tumors in other salivary glands like submandibular and sublingual. Most parotid tumors क्या होते हैं डॉक्टर? Pleomorphic adenomas is what you should remember. So what is the first priority? Always A, B, C. Airway is the first priority. Paget's disease may most frequent site of deformity is pelvis. And the Paget's disease is also called osteitis deformans. Then intertrochanteric fracture of the hip. What is the associated fracture? The distal radius is most common. Actinomycosis commonly mandibular. Where do you see muscle hernias? It is the tibialis anterior hernia. is the most common muscle to have herniation is what you should remember. Osteoclastoma के malignant potential depends on the spindle cells. So accordingly, grade 1, grade 2, grade 3. Grade 3 means a typical hyperchromatic, numerous mitotic spindle cells. Torus fracture. It is typically the distal radius fracture. Is what you should remember. It is a buccal fracture, common in the case of the children. The bones in children are soft, so they don't break, but buckle. A buckle under the pressure is what you should remember. When there is a severe pelvic fracture, if you want to stop bleeding, what is the best way? External fixation is most effective way. Pelvic fracture is one of the most common visceral injury. It is the urethral tear. That's the reason always pelvic fracture bole to, you have to watch for the urine output. Fracture of the clavicle. It is usually the junction of the lateral 1/3 and medial 2/3, which is the most common location for the development of the fracture is what you should remember. Childhood cataract has worst visual prognosis, doctor. It is the posterior persistent hyperplastic vitreous cataract has the worst prognosis. And commonly, it is also called Patau syndrome. I mean, it's a part of Patau syndrome. Glaucoma, cataract, microphthalmos are often coexisting. Juvenile rheumatoid arthritis में chronic uveitis कहाँ ज़्यादातर होता है? Pauci-articular JRA with the onset under 7 years and a positive ANA test में there is a greatest risk of developing chronic uveitis. So if you look at the Pauci-articular type, doctor, most common type of JRA is Pauci. 60% of cases, it involves less than 4 joints. Rheumatoid factor is negative. Chronic uveitis is highest, especially if there is a ANA positivity, is what you need to remember. Which visual field defect is most characteristic in glaucoma? A paracentral. Circumscribed paracentral defect is a very early sign in case of the glaucoma. Hypopyon with uveitis, where do you see? Reiter syndrome, Behcet syndrome, ankylosing spondylitis. So what is warped Koyanagi-Harada syndrome? So what can you see here, doctor? Vitiligo. You are able to see vitiligo. So, vitiligo, alopecia, poliosis, uveitis, retinal detachment, depigmented fundus, Dellen-Fuchs nodes, not only in sympathetic ophthalmitis, deafness, vertigo, tinnitus, meningitis, encephalitis, they can be there. In the case of the warped Koyanagi-Harada syndrome is what you should remember. If you want to look at the optic disc, you should use plus 78 diopters, plus 90 diopters lens. Typically, it is circular, well-defined, pinkish, cup disc ratio 0.3. Whereas, glaucoma may how the optic disc looks like. So this is one of the favorite image-based MCQs in the tomorrow's NEET PG exam. Uveitic glaucoma may don't use prostaglandins. Avoid 3 P's, doctor, in uveitic glaucoma. जब uveitis होता है, glaucoma होता है. Avoid prostaglandins, avoid pilocarpine, avoid physostigmine. The prostaglandin analogs, bimatoprost, letanoprost, travoprost, they should be avoided. And they break down the blood aqueous barrier, they increase cystoid macular edema, cystoid macular edema, and even physostigmine, pilocarpine should be avoided because they promote posterior synechiae. So you use stimulon, yes, estrozolamide, yes, to lower the intraocular pressure, and corticosteroids are the drug of choice whenever uveitic glaucoma is present, is what you need to remember. Thorpe's striae, where do you find? So in congenital glaucoma, you find horizontal breaks in the Descemet's membrane, which are called Thorpe's striae. Snowball obesity is inside the vitreous. Snowballs inside the vitreous. Where do you see? In case of fungal. So whenever there is candidiasis, then that leads to snowball opacities. Similarly, string of perils appearance due to the vitreal exudates whenever candida endophthalmitis is there, then that leads to steroid-induced glaucoma, commonly due to betamethasone. Pregnancy-induced hypertension may narrowing of the nasal arterioles. Even tomorrow when you become obstetrician, you should not forget to carry the fundoscope a lot of times. Attenuation of the arteries is the first change in retina due to hypertension. So, doctor, let us take a 5 minutes break. Go to the kitchen. Pick up a cup of tea. Breathe yourself. Tonight, what are the topics that you are going to do the revision? And once more, Dr. Murali Bharadwaz will be back and we will finish the remaining questions. ठीक है, 5 minutes break ले लेंगे. आप फटाफट एक गर्मा गर्म चाय बना के आओ और डिस्कशन कंटिन्यू करेंगे, राइट? So welcome back, everybody. And let us continue our discussion. Paramedian position is assumed by the vocal cords after you divide recurrent laryngeal nerve. Why? Because cricothyroid muscle is not supplied by the recurrent laryngeal nerve, which is responsible because of its unopposed action. It brings the vocal cords into paramedian position. Once more, sure, short, topical for the tomorrow's NEET PG exam. क्या होता है? आज ही आप रिवीजन करना. Please go back to the Incus 2000 HD video library. Vocal cord paralysis is the favorite topic of the examiner doctor. Unilateral acquired sensorineural deafness in children. It is ototoxicity commonest cause. Scleroderma can involve the esophagus. It's called crest syndrome. Calcinosis, Raynaud's phenomena, esophageal dysfunction, sclerodactyly, and telangiectasis is what you need to basically remember. You want to detect a non-palpable cervical lymph node mets, then PET scan is a very good way. Deviated nasal septum, any birth molding, direct trauma, genetic, any of them can be responsible. Subglottic carcinoma of the larynx, earliest presentation is with strident or laryngeal obstruction. Whereas the hoarseness is only a late feature because subglottic means vocal cords के नीचे, यहाँ से ऊपर जाना, vocal cord को involve करना, then only hoarseness of voice appear. That takes a little longer time is what you should remember. Middle ear to infection intracranially, how does it spread? Through cochlear aqueduct, round window membrane or oval window, any of them, it can spread. What is the lining of the vocal cords, doctor? Stratified squamous epithelium. Keyhole appearance of the glottis. Whenever phonesthesia, politicians, church priests, they talk. Ultimately, phonesthesia will occur. If you do laryngoscopy, you find keyhole appearance. Carcinoma larynx, most common site is often the glottic area. It usually involves anterior 2/3 of the vocal cords is what you should remember. How are fallopian tubes developed, doctor? Paramesonephric ducts, also called Mullerian ducts. So, uterine tubes, uterus, cervix, upper 1/3 of the vagina. Mullerian duct, it basically arises. Commonest route of spread of TB of the genital tract, hematogenous spread. What is the drug of choice for the emergency contraception? Levonorgestrel, 1500 micrograms single dose or 750 micrograms doses 12 hours apart. What is the lifespan of copper T380A, doctor? 10 years. LH, FSH, HCG, they're all glycoprotein hormones. Myoma, it is the hyaline degeneration, which is most common type of degeneration. CIN2 pregnancy है, क्या करना चाहते हो? Immediate conization. And so regular pap smears, colposcopy every 3 months during pregnancy is considered to be the management. Observation till delivery, not conization. Observation till delivery, because conization precipitates abortion. So that's the reason. McIndoe's operation is a kind of vaginoplasty for the vaginal atresia is what you should remember. Estradiol is a C18 steroid. So you should know cholesterol is 27 carbon, Progesterone is 21 carbon, testosterone 19 carbon, estradiol is 18 carbon. That is what you have to emphatically remember. So what does maturation index 0, 95, 5 कहाँ होता है? पहला ये क्या है मालूम होना आपको? MI, percentage of parabasal cells, percentage of intermediate cells, percentage of superficial cells. Of all these parabasal are least mature cells, not yet affected by estrogen or progesterone. Superficial cells are having most maturity. Wherever estrogen is in abundance, then you see superficial cells. At birth, 0.95 by 5. Like that, the proportion of parabasal, intermediate, superficial keep varying during different parts depending upon the abundance of progesterone and estrogen is what you need to remember. Sinusoidal fetal heart pattern, it indicates fetal anemia. Sinusoidal pattern. Hyperechoic ring around gestational sac in adnexal area. What is it called? Begel sign. Begel sign. There is a homogeneous mass in the fallopian tube that's called blob sign. Inhomogeneous mass. Then hyperechoic ring around the gestational sac in adnexal area is called Begel sign. Similarly, blood in the pouch of Douglas is another important indicator. So what are the important components of the White's classification of the diabetes in pregnancy? Onset of diabetes, duration and associated complications. That is the Priscilla White's classification of the diabetes is what you need to remember. Class A1 is gestational diabetes, diet control. A2, gestational diabetes, medication control. Class B, onset at age 20 or older with duration less than 10 years. So that way, onset, duration, associated complications, they decide the Priscilla White's classification of the diabetes is what you have to emphatically remember. So what is Chignon? It is an artificial capsuccedaneum, which typically happens whenever you apply vacuum. Usually, कितना pressure लगाते vacuum extraction में 0.2 kg per centimeter square is the pressure that you apply for the vacuum. After coming head of the breech को खींचने के लिए we use the Piper's forceps. Tomorrow's NEET PG. This is going to be image-based MCQ. So what is the most common cause of breech? Prematurity is what you should remember. Most common type of breech, frank breech. How do you deliver the head? Burns-Marshall method, Mauritius, Civilivit, Piper's forceps. Extended leg है तो pinard maneuver करो. Extended arm है तो Lovesets maneuver करो. That's what you should remember. How do you confirm hyaluroniform mole? Often it is a clinical examination. The most common symptom of the hyaluroniform mole होता है vaginal bleeding, which is seen in 50% of cases. What is the most common sign of the hyaluroniform mole? Uterus, which is disproportionately larger than the estimated gestational age according to the last menstrual period. Triple test is done at 15 to 20 weeks. HCG, alpha-fetoprotein, estriol, they're all the components. So, when you give anti-D gamma globulin, you should remember whenever RH negative mom gives rise to RH positive, direct Coombs test positive, that is the indication. And how much will you give, doctor? 300 micrograms of anti-D immunoglobulin is given to the mother. So what are the physiological changes of pregnancy? Favorite question, doctor? Out of 20 questions that come from obstetrics gynecology, जरूर एक क्वेश्चन आएगा physiological changes of pregnancy. So increased cardiac output, increased blood volume, increased plasma volume, pulse rate, decreased TPR, decreased pulmonary vascular resistance, decreased arterial BP. They're all the physiological hemodynamic changes is what you need to remember. When the cord attaches to the margin, इसको क्या बोलते हैं? Battledore placenta. The mother's blood volume, normal pregnancy weight increases by about 40%. And during pregnancy, thyroxine binding globulin normally increases. Oligohydramnios can be seen with renal agenesis, poor placental perfusion or postpartum pregnancy. Anencephaly में poly होता है. Fetal heartbeat you can identify by about 6 weeks. Transvaginal ultrasound. Now the beta HCG curve in a normal pregnancy, when will beta HCG will increase and reach a peak? 10 weeks. It reaches a peak. Softening of the cervical isthmus को क्या बोलते हैं? Hegar's sign. In twin pregnancy, the first twin is at greater risk than second is wrong. Second is at greater risk. But twin pregnancy may, there is a more stretching of the uterus that lead to development of postpartum bleeding. Uterine size date disproportion is most often is due to inaccurate LMP, last menstrual period. Coming to the dizygotic twins. Dizygotic twins. There are 2 chorions, 2 amnions, most common type of twin present in about 2/3 of cases. More than 1 sperm, more than 1 egg. Fertilization lead to dizygotic twins. A primigravida, 8 weeks, threatened abortion. अगर abortion threatened है, so if the abortion is threatened, then what will it show? It shows a intact gestational sac with a fetal heart motion. So threatened, inevitable, incomplete abortion. ये तीनों में what are the differences in ultrasound and physical examination? You have to be very sure, doctor. So that brings us to the end of today's daily NEET PG live discussion. So don't forget, wake up in the morning, take up the test on the Incus app, daily mock test, and join the evening live discussion on the YouTube, and also bring your friends. Good night. Thank you.